Good afternoon and good evening to all of our attendees. Happy Mutual Unity webinar. I am Bailey Meerhoff, and I am going to be helping out Mike and Julie today. Let me go ahead and say that for majority of our questions, we are going to wait till the end. You can type them in, but we will save our important questions for the end. If you want to extend anything that Mike or Julie have to offer, you can raise your hand and I will unmute you. I will go ahead and say, hey, Amy, you're unmuted. If you have a question, go ahead and ask it now. And then once you are done, I will go ahead and take you and put you back on mute. So Mike, want to go ahead?
All right. Yes. Thank you very much, Bailey. And hello, everybody. I wish I could see you, but we're gonna do this as best we can without. In person next time. I'm sure will be great. And thank you so much for attending our session. We're really excited to hear and learn from you and share with you what we have learned as well. So our presentation is called CHWs, Career Advancement Strategies, Nothing About Us Without Us. And my name is Mike Young. I am the Director of Equity, Diversity, and Inclusion for PASOS, a statewide nonprofit in South Carolina that supports the Latino population, and also the Center for Community Health Alignment, which develops the workforce.
Yeah, and I'm Mike's co-presenter. Both of us are community health workers. So again, as we are leading this session on Nothing About Us Without Us, we are absolutely putting our money where our mouth is. And here at the Center for Community Health Alignment and at PASOS, which we're together, we're partners, we're co-located, we're merged, we're very synergistic. All of our work is led predominantly by community health workers. Like I said, we are two of the leaders of the organization, and we're both community health workers ourselves and have that grassroots experience all the way to advocacy and statewide leadership experience. The Center for Community Health Alignment, just to give you a tiny bit of information, we are part of the Arnold School of Public Health at the University of South Carolina, and we are here to advance health equity by supporting and co-creating solutions alongside communities. So what is like the largest solution that we support? It's community health workers, it's us. I mean, and what we're doing is working to support our workforce to be successful and to be able to achieve those outcomes that we all know are possible. So we provide training in English and in Spanish. On core competencies, we have multiple specialty tracks. We provide technical assistance and capacity building around implementation of community health worker programs based on best practices. Because as you guys know, you can't just take somebody and pop them on the head and say, you're a community health worker, go do great things. We have to start with our qualities and the qualities of a community health workers, but then when organizations are implementing, they need to follow some best practices and some evidence about how to do this work correctly. And so we provide technical assistance around that. And then we're also working on policy and evaluation of community health workers. And we work hand in hand very closely with the South Carolina Community Health Worker Association, who are our sisters and brothers in this work and all the progress that we made. So we are one of the Unity Conference sponsors very proudly because we got some funding, and you'll see on this first slide, from the Johnson & Johnson Foundation. And so we used some of that funding to help sponsor Unity because we wanted to come in front of you guys and pick your brains. So you'll hear a little bit more about that. But the Johnson & Johnson Foundation has an initiative called Our Race to Health Equity. And that is their commitment as a national foundation and a national company to help eliminate health disparities for people of color in the US. It was super exciting to talk to them because they said one of the things that they do is to support the health workforce. And we said, well, who in particular? And they said nurses, which we have a lot of experience about, midwives, which we've got, a lot of expertise around, and community health workers, and that they have a national commitment to support us and our profession as community health workers, which was fantastic to hear. But they said, we don't know how to do it. So as organizations, NACHW, Center for Community Health Alignment, others, please help us figure out how to best support this profession that we know of and we believe in, but we need to know how to best support. So with a lot of kudos to Johnson & Johnson Foundation, we'll go ahead and move forward. And I don't even think I said, I'm a community health worker, been one since 1997. Very proud of that, and and I'm on the board of the National Association of Community Health Workers.
And I've been a community health worker for 5 years and going strong, looking to do some more years. So today, what are we going to do? Like any good project, we want to make sure that it is a shared experience and we learn and grow on the topics together so that it informs it. That's the whole point of the nothing about us without us. This whole thing is about we shape the future. And this entire presentation is going to be a conversation done in an interesting way. We're going to talk about the type of presentation that we have, the way that we're going to interact with you. And but the purpose is to inform a larger initiative to really get what is going on, what is needed, and what can we do to strengthen those areas that do need a little bit more attention. So we're going to talk about the existing models of community health workers, what's going on, what kind of initiatives are receiving attention, and what areas of the community health worker workforce could use more attention. Specifically thinking along the lines of like career paths and where to go next in the field of community health workers. So we've looked through the literature, we've read about the ways in which that different organizations, countries, nationally, state, local, all have formed these. And we keep having discussions to make sure that everything that we do is relevant to the work and the workforce. And then of course, to fix something, we have to talk about the challenges but also celebrate the successes. So we want to hear and share some of those challenges and successes to make sure that what we're hearing is what you're also experiencing as well. And then also learn and potentially be able to share some of the best practices and things that have made your work so successful as well with others, because we're all in this together and we want to see everybody succeed as well. So we're thinking about things of like professional growth within community health workers. What does that look like? And what do community health workers want? And what do we need as a workforce to really make our impact as substantial as it can be? Because we know it truly is changing lives and generations. So yes, we want to make sure that we discuss things like how to get community health workers involved and integrated into all aspects of the work within organizations, within research work, or within policy making, and what is it going to take to get there. And also we want to make sure that this is a true peer-to-peer learning. That is a key component to our work, and we all know that, we learn from each other. We're all teachers as well as students, and we're going to be sharing, and you're going to learn because you're going to see the responses by everybody as well. So we're going to move along and you're going to see what everybody is stating. So we're going to talk about that, and you're going to get a chance to share your input and also learn.
Awesome.
Yes, this is going to be interactive, so I hope you're all wearing your participants.
And if y'all missed that, your participants, get it? Mike's really good at dad jokes, so he may throw in a few of those every now and then. So, I mean, for those of us over here in the East Coast, it's late. We need a little humor thrown in there to keep us all awake. So, as Mike said, the objectives of this session is that we're honestly going to learn from you, and we're going to form this together. So, like, we have a couple slides of presentation. The rest of this is going to be you guys sharing your thoughts. Okay, so why? We're going to be talking about career ladders, career lattices, career pathways, however you want to define it. But why is this important? And we're going to ask you guys in just a little bit to tell us why, but we'll tell you why we even started thinking about this, right? So many of you guys, gosh, I wish I could see your faces or have you in a room, because I'd be like, how many of y'all have ever been told that if you want to go up in your field, or if you want to get a better job or a better salary, then you should go be a social worker, or you should go be a nurse, or you need to go do this and leave our field. And I wish if I had you all in a room, I'd probably have like half the hands going up. But since we don't, again, in just a second, we're going to ask for your input. But so many of us are told that in order to advance as community health workers, that we're an entry-level profession and that we need to go do something else if we want to have more benefits. Others of us, like in my position, there have been times when people have said, but you're an executive director now, so you're not a CHW. And I'm like, excuse me, wait a minute. Just because I'm an executive director, I've gotten here by starting in grassroots, starting in the field, getting that experience, and then choosing to use my experience to then impact others and help others find that path and choose that path if they were the right folks, and to expand this workforce, right? That doesn't make me, in my opinion, no longer a CHW. Now, am I on the grassroots? No. So do I have to interact with people who are still at the grassroots? Absolutely. But it doesn't make me not a CHW, right? I'm still a CHW, but I'm in a different role. So again, this is why we as a profession need to inform what our career pathways look like. Other CHWs have said we need advocacy tools because we may think this, but our employers are telling us differently. So we need some tools to advocate for how to grow in our career. And what should some of those growth paths be like, right? And so again, nothing about us without us. It's up for us to decide. So we went to Johnson & Johnson when they said, hey, what is something that the workforce needs nationally? We said, you know what? And go ahead, Mike, if you could, to the next slide. We said, we've been hearing from a lot of different people that this is an issue and that we'd really like to try to figure out what might some of the solutions be, right? So again, as I said, this whole initiative of trying to figure out, okay, what could some career pathways for us look like, and some guidance around that, some tools around it. It's all been CHW led and driven. Okay, so this is not people from the outside coming and being like, y'all should do this. No, not that allies aren't important, because absolutely, we would not be where we are, and we couldn't do a lot of the work that we do without the essential contributions of allies. But we also know that when it comes to defining our workforce, it should be, led and really, really informed and driven by us, right? So where did this conversation start here in South Carolina? Well, we have a group of South Carolina community health worker ambassadors, and you see some of them right here. And this was before COVID, when we could get in a room together. And so you see we have like the Post-it notes up, and we were walking around and we were talking about different topics, and we were getting everybody's input, and then we discussed them, like CHWs we do, right? And one of the things that came from the CHW ambassadors here in South Carolina was says, sometimes we feel like we just get to this stopping point, and they tell us we can't really go any further, or there's no salary guidance. So we come in with this entry salary, and then when we want to move up or when we get more responsibilities, there's no additional salary because nobody's told them that there should be, right? Or what our value is. So we said, okay, we've got these ambassadors. Now we have 17 community health worker ambassadors here in South Carolina who are a diverse, amazing group of leaders in our field. And then we also pulled together, I think it was 7 or 8 CHW supervisors and managers that were recommended by the ambassadors as good supervisors and managers. And we started having this conversation. Okay, what if we had a pathway? What if we had tiers? Or what if we had like a ladder or a lattice for CHWs to broaden in our careers? What would that look like? And the ideas started flowing, right? So then over the years too, I've had lots of conversations with community health workers around the country, and the same thing has bubbled up. Like, we don't want to have to leave, but we want to advance, right? We've got more skills and more things to offer, and so we want to have more opportunities. So then, as Mike said, we got this funding from Johnson & Johnson Foundation. We said, let us work on this, right? And like dig into it a little bit and have some support to do so, and go to CHWs at Unity with these questions, and participate in the NACHW national survey and get more input, so that it's not just South Carolina CHWs, but it's CHWs all over that are informing this work. So we've done a little bit of a literature review. We're doing some interviews of CHWs and supervisors. We're looking at and meeting with folks who have existing models of career pathways or tiered CHW programs in different places. We have also helped to form the Southeast Community Health Worker Network, and we've gone to members of the Southeast Network and said, you know, what would this look like for you, and what exists, and what would you want to see? And then going forward, in just a second here, Mike's going to tell you how we're going to kick off the participatory part of this session, and we are going to use your input as we go forward and develop any tools or processes or best practices that we can about our career pathways. The other way that we're going to integrate CHW input is you guys may have gotten a link to a national NACHW survey. And there's questions in there about career CHW tiers or a career pathway and what things should inform that. So we're also going to get data from that survey because we're working hand in hand with NACHW on this project. And that data that is of and by CHWs is also going to inform this work. So again, we're trying to do the most comprehensive work. We thank you for attending and giving us your input today so that we can build this together. If after the session you have something you want to share, like an innovative model or an idea or something that that can also help inform this, then please feel free to contact us. We didn't put in a contact slide at the end, but maybe we can write it in the chat at some point, Mike. Yeah. But you can contact us because again, we want this to be something that helps all of us as a CHW profession. All right, so now for the fun part.
Yeah, so the exciting thing about this is that all of this that we're working on is for everyone. It's something that we hope to utilize to strengthen and provide, you know, to give more information about what's going on across the field so that maybe it can influence and strengthen any of your existing initiatives as well. So this is a learn and share, you know, so we're putting in the time now to hopefully, you know, it pays off so that we can all benefit from this together. So I've seen some people with the hearts already, which is exciting. And I see that we have 131 people on. That's really cool. So yay. The way this is gonna work is we're using an interactive web platform for this presentation. It's called Mentimeter. If you could please open up another tab on your web browser or use your cell phone to participate. You'll need to go to menti.com at the top, like you see here, menti.com, and enter the code 12390785. And you can see that at the top of our presentation. So the questions that appear on the screen that you'll see in a minute will also appear on your screen or browser. Your answers are completely anonymous and will show up in real time on the screen as they are input. We have a variety of question types, multiple choice, open-ended, and word cloud. We will explain what to do as we go. Also, if you have any questions, please put them in the chat and our presentation moderator will alert us and give you the opportunity to unmute yourself if you'd like to further the conversation verbally as well.
And there's also going to be a couple moments where we have like open-ended questions. And we are going to ask, like, if anybody has a particular thought or idea that you want to share out loud, to put it in the chat, and then our moderator will let us know. You know, you can raise your hand as well, and we'll unmute a couple people to share. Like, if you're like, ooh, I've got a really good idea on that, and I want to share, we want to hear you. So we'll there'll be a couple moments when we ask, okay, anybody want to share an idea or a thought around that? And I love seeing all the hearts.
Yeah, the hearts are awesome. So the first question is, how long have you been a CHW, CHR, promotor, promotora? I know we go by a lot of different names, so we decided to use those, but.
Or an ally. We got allies in here too, yay.
Yes, allies. It's so neat to see. We're almost at 60 responses, that's great. Thank you so much for responding and being active in this with us.
Also, if you're having trouble connecting to Menti or you need the instructions again, maybe write that in the chat, and then Bailey, if you understand, you can answer them, or they can unmute and ask if they need to, because we really want to make sure, if at all possible, that folks can participate. So if you have trouble with the instructions or with Menti, you know, let us know.
They need the phone number again.
It's the code. So it's menti.com. You go to menti.com, menti.com, and you use the code 12390785. And it's at the top of the screen if they can see
So
it.
Bailey, if I write it in the chat, can people see it just in case they can't see the screen?
Yes, it is presented to all.
Okay.
Great. Okay, I think.
Just in case somebody is like using their phone and can't see the screen, I put the website in, and then the code is 12390785, and I'm putting it in the chat. So it's the menti.com, and then that's the code.
Awesome.
Excellent to see more than 10 years. That's awesome commitment. Great job, y'all. And some great people getting started into the field. That's really exciting too. It's gonna be a
Look at
very
that.
big
18
ride.
across.
Aloha
Yeah.
from Hawaii.
Oh wow, awesome. Aloha.
Aloha.
We're gonna go to the next question. 78. That was a good number. Next question. In what setting or settings do you operate in as a CHW or ally? And we provided a few options for you. You could choose from those.
And I think you can choose more than one. So if your organization is a hybrid type organization, feel free to choose more than one. These first few questions are just kind of some background to see like where people are and how long you've been a community health worker. And then we're going to get into kind of the meat of what we're talking about related to career advancement.
Yes. Nice. Pretty solid 2/3. 1/3 being community-based organization, nonprofit, and the other third being healthcare, hospital. All independent advocacy. That's awesome. Public health. Absolutely. Excellent. Well, we hit the same about a number of participation. Give it like 5 more seconds. All right, still going. All right, thank you. We're gonna go. 82. Not bad. All right. Does your organization have career advancement opportunities for CHWs without leaving the CHW field? Yes, no, not sure.
So just to put this question in another way, like if you're a CHW at your organization and you want to grow in your responsibilities or in your salary or even like your tier, maybe you want to become a supervisor or manager, maybe you don't, but you want to be recognized for your years of experience or get more development. Is that something that's an option for you as a CHW that's already kind of baked into the organization? Or is it kind of, there's the one job description of a CHW, and really to advance, you'd have to leave the CHW field?
And we're going to get into the specifics in a later question about what these are, what they look like, what is desired, and hopefully we can shape the way that it works, that people understand what our workforce wants. Excellent. We got 88 responses. I love it. Moving on. Does your organization have education or experience requirements to promote CHWs? So that means like, do they have to hold a certain credential, like a master's in a certain field, or have certain years of experience in the community to prove that they are legitimate enough to move up to some next level? Or would it, could be no, it could be simply there is no movement. That could be an option. Once you're in, that's it. Interesting, about 50-50 right now.
And I know we're going pretty fast because we want to get to kind of the meat of like what you guys think about this. If we're going too fast, Bailey, if you see comments about going too fast and needing us to slow down, let us know. I know we're going pretty quick because we've only got an hour, but please, let us know if the pace is too quick for a number of folks.
Hitting that 80 threshold that we seem to be kind of plateauing on. So wait just a little bit longer, give somebody a chance. And the next question is going to be open-ended. So that one's I'll let Julie take that one on. And here we go. Oh,
actually, there's one more multiple choice, and then we'll get into some of the open-ended ones. So now we're kind of getting, the first questions were really about you guys and your particular organizations. Now we're going to look at our field, right? Our profession as a whole. Do you think that there's enough guidance and options out there for us to use on how we can advance in our field? Because maybe there is. When we want to do something and we want to advocate for ourselves, or our associations want to advocate for us, we typically look to see like what's out there, what's the guidance, what's the best practices. In other fields they look to the journal articles or the universities or the statewide meetings or national associations. And we're beginning to have more and more of that, right? But right now, do you feel like if you wanted to look for that guidance and for those options, is there enough out there for us to be able to use as organizational leaders, as community health workers, as associations, as allies?
And that's a pretty solid, resounding overall no, which is good to know, good to learn from.
And there's a few that say yes, which so in just a little bit, when we start talking about some of these questions, those of you guys who do feel like you have enough guidance out there, we may ask you to share, what you're using, or to share it with us as we try to, come up with some tools that will help respond to this no block, right? Or to the not sure block, so that we do have more guidance and support as we try to advocate for ourselves and as organizational leaders as we help create these career paths. All right, Mike, I think we can go on to the next one. All right, so we have said that the majority of you guys said, and our ambassadors here and different folks have said to us, look, we need more support and attention on what our options are for career advancement. So this is an open-ended question, and you'll see in the Menti that it gives you a place to write. Why do you think that we need to focus on this as a profession? Like, why is career advancement or a career ladder something that that we need to look at and concentrate on?
And this is an open-ended question, so you can write as much or as little as you want. And remember, it's completely anonymous, and your responses will show up.
I don't see anything showing up, Mike. Are we good to have those? Oh, here we go. Popping up. Clearly, I'm impatient.
Retention, respect for their skills and work that few people are willing to take on.
It's how healthcare should be, because there's not enough foundation. Increased respect. Community losing great people due to the requirements of advancement. CHWs are often one paycheck away from needing the services we provide. Powerful.
Yeah.
For sustainability, and so we can elevate entry-level positions to positions of power and leadership through educational and financial assistance. Nice.
Yes.
A lot of people are still unaware of what CHWs are.
Yes.
To grow the profession as a whole, so we can stay in this field as a long-term career. Props, yes. Mm-hmm. Here's to that, because a lot of us really want to. You know, and then there's the side of like, and we also have to feed our families. To provide more tools and resources. If we don't have career advancement, we'll leave. People will leave. Feel like CHWs are not valued in the community, and so they don't think we should move up. Well-trained CHWs can improve people's lives. It also saves money on hospitals. Otherwise, our careers will stay stagnant. Visibility of the field, mentorship, keeping knowledge and expertise in communities and local jobs. Yes, right? So that when we're in communities, we can stay in communities and still be able to achieve that personal satisfaction. Great. Thank you for sharing that. The value we bring to the workplace, also building the workplace. It's about equity and social justice, reducing burnout and turnover. Other fields have advancement ladders. Why shouldn't we?
Absolutely.
Because the way that things are now, we're losing strong CHWs. Other organizations take us. It's very true. How many of us have lost really good CHWs because we couldn't pay them enough on our grant funds, and we lose them to another organization that had higher pay or better options? In Ohio, I'm working on this right now. Awesome, Ohioan, we would love to connect with you. I didn't know this was a field until I got the job offer. Good, great point. All right, so maybe just a few more seconds on this one, Mike, you think?
Yeah, we'll just scroll a little bit.
We are the glue to life in our hood. So health inequalities improve. We are special.
Wow.
Awesome. Respect from the clinical side. And these are anonymous, but we're probably going to use some of these snippets when we go to report this and say, look, these are what the CHWs at Unity said about why this is needed, right? Because again, we want to make sure people understand that that this is something our profession wants and needs.
That's awesome.
The CHW is a career.
Yeah, why can't it go all the way to the top? I like it.
Can't we go all the way to the top? Exactly. And
awesome.
we don't change who we are, right?
Got 90. Wow, we're getting over 90 on this one. This is great.
Fantastic.
Right. Thank you so much.
We got an email thrown in there, so we will we'll have these results, and we'll reach out to you, E. Thomas.
Absolutely. Nice. Absolutely. Okay.
Awesome. All right. So sorry if you didn't get to throw your answer in there, but we wanted to get on to our next question, which is, so if we're thinking about moving on that ladder or on that lattice or that pathway, what factors should be considered? So like, what are the things, like if we want to give ideas on like how organizations can create this ladder, right? Or build these opportunities, these different pathways for us. What should help us? What should be the things that help move us, transition us from one level to the next? All right. Definitely support from the board is needed. Lived experience along with education. Okay. Experience and education. All right. Experience and not just letters after your name. Credentials, skills, and experience. Education, certifications, areas of expertise, years of service, lived experience. Education, experience, and understanding of the role requirements, okay? More training beyond certification. So maybe having that initial certification, but then as you build on that and increase your toolbox, that allows you to move up. The likeness to your community served, great. Because again, that's something that we bring that oftentimes other members of the team may not bring, right? And that needs to be, in my opinion, respected and supported, just like any other profession has that support.
Mentors.
Right, mentors. So maybe either becoming mentors or having mentors to move up. Sometimes help with other programs like expungement if someone has a record. This is a real barrier. Interesting. Great point. mentorship programs. So I'd love to hear of those folks who are talking about mentorship. If anybody is interested in raising your hand and speaking to that, are you saying like it would be helpful to have a mentor to help us move up in our careers? Or are you saying that as we become mentors to other CHWs, that should be a way that, like, since we're supporting our workforce, that helps us move up? I want to make sure I'm understanding the mentorship better. Is there anybody who said mentorship, who could unmute and share a couple thoughts?
I'm waiting for a hand to raise up.
It also makes me think of like seeing somebody and learning from them doing the work as well. So like shadowing and also like having somebody advocate for you. So like I could see that also being something that would be beneficial. Not if that's what they meant, but that's what I thought of.
And if you don't want to raise your hand and talk, that's fine. I know it can be like, it's intimidating. There's lots of people on, or you might not even be in a space where you can unmute. But even if you wanted to like put it in the chat, then Bailey could share it with us or read out what you said about mentorship.
There is one. Renee, I am going to unmute you.
Hello, Renee.
Hi, Renee.
Renee, can you hear us?
Hi, can you hear me?
Yes.
Yes.
I unmuted my headset, but not the actual thing. So anyway, thank you very much for this opportunity. So mentorship, I didn't write it, but when I saw it, I was like, yes. And so what came to mind is that not only as a community health worker, being able to kind of mentor other new community health workers coming into the field, but also going to the people that have come before me to get mentorship from them. So that would be definitely helpful in my city. I don't really know any other CHWs outside of my organization. And so it would be really helpful to be able to connect and get mentorship and menteeship with other CHWs.
Yeah, awesome. Thank you so much, Renee. And one of the ideas that's been floated here amongst our ambassadors in South Carolina was perhaps serving as a mentor could be something that, like, that actually helps you move up in that ladder, in that tiered, if there's like a tiered system, that like by mentoring other CHWs in the field, it's actually a way for you to increase in your own field, because you're giving more, right? You're increasing in your responsibilities. Very cool. So mentorship was a big one.
And we were involved with the creation of the South Carolina Community Health Worker Association, and that brought about a lot of peer-to-peer learning as well. So seeing what other people are doing, like we didn't even know some were out there doing it, and then we started bringing them together, and you start sharing experiences and you learn, and then just creating that structure behind the relationships and the networking. We've considered that be part of our mission, is thinking through how to build and help and to support others to build these kinds of networks, because it is so important to learn from each other and see. It's hard to be something that you can't see.
I'm gonna read this one last one. Need to be inclusive of those who don't have a high school degree or who are undocumented. Want that person to know that we saw that and heard it. And all of these we're gonna look at. And it is a very, very important point, that this is not just about advancing within a particular type of organization. We need to think about this for our entire field, and that there's going to be nuances based on where we work and where we are. So thank you for that. All right, Mike, this is you, I think.
All right, everybody. So in your opinion, how can we better support CHWs in advancing their careers? Thinking through, what do they want? What would it take to advocate? And what is our role in that as a fellow CHW? If we supervise CHWs, if we have seats at tables? How does that work? You know, what is it going to take to support our CHWs so that they are amplified and the microphone gets passed to them? So
One thing
mentoring.
through, like, you know, if a CHW who's participating in this session is working at an organization, you know, thinking through like what would be helpful for me to be able to advance where I am, right? What could be helpful for me to tell my employer? What would be helpful for my employer to hear? What would be helpful for my association to know, or for NACHW to provide, for example?
I like the incentives for continuing education. So not just education for the sake of education, but yeah, like qualify it and give it some actual tangible besides learning benefit. Respect.
And then
That's
teaching how to advocate for their team. That's good. So more training or opportunities to practice advocacy for our own profession, right?
Mm-hmm. Career navigator support.
Opportunities.
Professional development, apprenticeship, dual trainings, more certifications.
Departmental training on the roles of CHWs, so that it's not just like it went away, but I saw that one. It's not just our supervisor who knows who we are, but the whole department or the whole organization.
Yeah. Paid internships. Educate CHWs on how to advocate for themselves. And that is something that we are currently developing as well. We're developing a equity, diversity, inclusion with advocacy as part of the main focus of our role, and understanding that as being such a huge part of what we need to do and why we do what we do, but really putting structure behind it.
Mike, there's one on here too that says be very aware of other career needs that we may have, that may not follow the path to higher ed or career advances, such as English as a second language, immigration status. That's really important.
Excellent. Okay, I think we should probably move to the next one. You cannot require a master's degree with $9 an hour. True.
Thank you.
Yeah, educate departments on how to create a trajectory. So just advocating on all levels.
Advocating to funders, for funders to help understand that it's not just like one size fits all.
Okay. For the sake of time, I think I'm gonna move next.
Okay.
So this one is a multiple choice, and there is an other if you want to put it in, but what additional benefits should be available to CHWs as they advance within their roles? So we've talked about these, and you've mentioned a lot of them, but maybe we could put a little weight behind them and see what you think is the one that you think most important. All of them. Okay, well, somebody voted for all. That's great. That was cool. So we have more pay, opportunity to supervise, more responsibilities, more professional development, management opportunities, freedom to operate more independently. Speaking opportunities, some like to get up and influence because you guys are influencers and inspiring. And if there's others that you want to put in the chat or call out, you can and raise your hand. We're here to listen as well. This is great. More professional development. We might need to, at a later time, explore what avenues of professional development is most desirable as well.
Man, I sure hope that next year we are doing this in person and we can see everybody's faces and hug each other and take all those pictures we take together and write everything on the wall and have interactive education, because this virtual stuff I'm about done with. So I'm hoping that next year's Unity will be part of our all of our professional development.
Yeah. I remember going to the 2019 one in no, that was in Dallas. That was awesome. It was just, it's so invigorating. It just refreshes you, knowing that there's so many great people out there doing great work.
Yeah, and then
Awesome.
seeing this too, it's like not just the opportunity of professional development, but our organization supporting us with the time and the funds to attend them, right? Because professional development opportunities can exist, but your employer has to provide the support for us to participate in that professional development.
Great.
And I wonder, Bailey, were there some of the folks that said other, did they write them in the chat?
No, but everyone is saying we would love to see everyone in person.
Definitely.
Yes. I
All
wish
of
I could
these are
even see y'all's
great.
faces. Do
We're
what?
people.
Everyone is saying everything is great. Great presentation. Love listening to you two.
Thank you.
And so for those of you guys who, gosh, I wish I could see your faces. We are people, and just looking at each other is like, we're doing the best we can. But for those 7 of you guys who said other, if you have an additional benefit and you want to write it in the chat for Bailey to read out to us, that'd be awesome. Because I'd love to hear what your ideas for other benefits are.
Yeah, or like I said, what areas of professional development are you most interested in expanding and fortifying? Because that's how we go ahead.
Policy changes to value our positions.
Mm-hmm.
Absolutely.
Yes, so it's written down, standardized.
Yeah, just to give some like insight on how we run things at Pasos, for example, we're all CHWs, promotores, promotoras, and we always ask our team, what do you want in professional development? And we have our semi-annual conferences, and we make sure that we bring those topics in to provide for them what they're asking.
I love this. So the top 2 answers are more pay and more professional development, and then followed by opportunity to supervise, management, which are kind of hand in hand, right? And the freedom to operate more independently. That's something that we've heard, right? That somebody's not like looking over our shoulders quite so much. So awesome. All right, so this is kind of not the last thing that we're gonna ask you to do, so don't close off your Minty. We have something fun at the end, but this is kind of like so we here at the Center for Community Health Alignment with our ambassadors, and again, like your input and the NACHW survey, we're gonna try to like pull all this together and make some sense of it so that we can help put out all together some like ideas and best practices and advocacy tools that we can use that is guidance and options for like our career advancement, right? Of all the stuff, so we've talked about a number of different things. What else does our team need to consider as we move forward in kind of drafting and creating some of these guidelines and options? What have we not said? What have we missed? And this is a time where I would love if anybody has a particular model that you already use that works. If you have a career pathway at your organization, if you have an idea of what we could do, I'd love for you to raise your hand and for Bailey to see your hand raised and unmute you to speak out your idea, your thought.
Yeah, if you've successfully implemented some sort of career advancement, share with us, please. What it took, what worked, even the challenges.
And if you don't want to raise your hand, again, feel free to type it in the chat and Bailey can read it out to us.
Ella, I'm going to go ahead and unmute you.
Hi. Can you
Hi,
hear
Ella.
me? Yes, so we just started implementing this. I'm with Ohio, so I'm the one who we're working on this with the community health workers now, and just getting it changed since we sit under the Ohio Board of Nursing. So in my organization, once we have identified a community health worker, or they have identified themselves that they want to go in more of a leadership role, we have classes that we send them to. So learn, advance, and then I forgot this one in between there, but the next one, once they have in the supervisory role, then we'll take them to Excel when they're part of the leadership team. So
Oh,
right now, as part of our leadership team, we when one showing that we're taking our community health workers out with us. So how to speak in public, how to present, how to that career path. Where do you see yourself want to go? And we're sending them, and we're working with them in that way.
that's excellent. Ella would love to connect with you and learn more about that because that sounds, like fantastic ideas that would benefit all of us.
I have another one. Candace, I'm going to unmute you.
Hi, Candace.
Hey,
Candace,
Can you
there you
guys hear
go.
me?
yes.
Yes.
Oh, okay, great. So I think that one of the things that we need to consider is not just higher wages for community health workers, because I know that's something that's been stated. By the way, I'm from Chicago. I work with Journey Care. We do hospice and palliative care, and I'm responsible for the south side of the city, which is predominantly African American. And I wanted to say that I think that there just needs to be more funding in general for community health workers. I know it's fairly new, and also um, have more grant writers. I don't know if that was something that was already said, or more grants that are written in specific for community health workers, um, and highlighting more of what's being done across the country.
Okay. Awesome. Thank you guys both so much.
I love the visibility comments, like especially this one, like Hollywood, but it's so true. Like people need to be informed about the work and the role and the importance and see it, and that's one of the main ways to get people's attention is through media. Gotta
And then
normalize.
I saw one that's easily understandable tools right there. So CHWs can advocate in conjunction with NACHW, right? So that, yes, we have a national voice now, but we as CHWs individually also need to advocate. People need to know who or what a CHW is, like a doctor or nurse. Yeah.
Yeah. Needs to be just common knowledge.
We have one more if you guys have time, or should we move on?
Sure, that's good. One more, and then we'll move on to our last slide.
And then we can open up again.
Yeah.
Anna, I went ahead and unmuted you.
Yes, this is Anna Huff from Arkansas.
Hi, Anna.
Hello, Arkansas.
How are you? We
Good.
are in the process of launching our certification program the end of July. We're so excited, but we have learned so much from other states and what they have done. And I just want to say, call folks in other states and see what's going on, because they already have a lot of this stuff resolved. I was in a session earlier, the folks from Texas were talking about their career advancement program that they have in place. It is fantastic. They start out as with the community health worker in training, and then a CHW1, CHW2, CHW supervisor, CHW manager. So they have it all laid out. So they have really done some work, and we have really tried to build on what other folks have done, and we're excited about it, and we're just in awe at a lot of the work that's going on, and what we're doing as community health workers is fabulous.
Awesome. Thank you, Anna, and I look forward to our Southeast Summit where we can continue to connect. I think the system you're talking about is Baylor, and we have talked to them, and I know that there's others out there. But one of the things that we've done is reached out when we've heard of systems that do have these tiered systems and talked to them. We've talked to a group in Chicago and Texas and another state, and look forward to talking to Ohio. So you are absolutely right, Anna, like building off of each other. So that's what we're hoping to compile, is like what exists out there, and then what do other CHWs say, recognizing that there's also nuances, right? Like there's what's possible like in a large healthcare system, and then there are other models that can exist, or some other best practices we can develop around, for community-based organizations, right? And smaller systems. So thank you for that reminder. And again, we'd love to connect with those of you guys who have systems already.
Chill with the grant deliverables. They're impossible expectations. I like the energy.
Mike, if you want to lead us through this next slide, and then I will put our emails in the chat, since we did not have a slide with our contact info.
Definitely. All right. Well, we know how important it is to celebrate each other because we're not celebrated enough by everyone else, but they will. So what we're going to do now is create a word cloud. And in one word answers, you have multiple areas to put a word in. What about the CHW workforce do you love? Tell us what about this is just so exciting and that makes you so passionate about what you do. And the words that get repeated will become larger. So you'll start to see different words grow in size, and those are the ones that that people are really resonating with. These are all great words.
That's my favorite part.
Yeah. Helping, passion, community, people, love, caring, dedication, inspiration, outreach, understand, independence, love and trust, advocating,
Aloha.
real life, empowerment, healthy, advocating for others,
Prolonged.
unity, connecting, creation. Yeah. Aloha.
Barriers.
Honesty. Changers. Absolutely.
Yes. I see an audience question. PenMed has a program too. That is another group, Mike, that we need to connect with. I'm familiar with them somewhat, but I'd love to connect with them. So we've got a couple more programs that we need to connect with and learn from. So thank you for that.
And while this finishes up with everybody's words, and you can put in more words, I think you can submit as many times as you would like on this one. We have 3 minutes left. If there's anything anybody would like to talk about or that we didn't cover, and you have any questions or just want to share something related to what we've been discussing that maybe need a little bit more attention, please raise your hand.
And Bailey, I don't know if I sent our contact information to the participants or if I just sent it to organizers. So if I didn't send it to the right place, would you mind reposting?
I sent it from the chat to the questions, and it should be sent to all that I went ahead and did.
Okay, thank you.
Candace, I will go ahead and unmute you.
Candace.
So I have a question. Well, first of all, the one word answer that I love is community, because I love helping my community, especially on the South Side. But also, what tips do the two of you have for community health workers? I know that the two of you mentioned that you've been doing this for a little bit. So what are some of the things that have kept you in the profession and is helping you move forward?
For me, it's been all about being allowed to leverage your strengths and being recognized for those strengths and having that shape the direction that your work goes. When you have leadership that believes in you, they see your assets that you bring, and then they nurture those and create the space where you're going to grow the most. And it's challenging at times because it's all new, but that is what has brought me fulfillment and brought me a lot of excitement and passion. And I see it in the other teammates that I have, like if they have a knack for training, if they have a knack for detail oriented work, you know, just give them the opportunity to really shine in that aspect, and it keeps people, you know, keeps them happy and keeps them in your organization.
And I think for me is I'm driven by social justice. I believe in a more just and fair and equitable society, and I have seen the power of us as community health workers to drive that work. And there's nobody like us to be able to change the world and change lives and partner with folks. And you know, and part of the reason that we're in this work that we're doing now, that we're working with you guys today on, is because we know the power of community health workers, but sometimes the rest of the world doesn't know and doesn't respect us, I guess, for all that we bring to the table. And so we're trying to help give our profession some tools to change that just a little bit. So yeah, I guess it's 7:30. We have to end, Mike. So thank you guys
all
so much. This information is invaluable. Again, answer the NACHW survey when it comes to you, because that'll be another opportunity to share some thoughts. You have our contact info. If you, and I believe too that these questions may be sent out in a post survey to folks who attended who wanted to provide more information. So thank you guys for your attendance today. Thank you for joining the conference. Thank you to our sponsors. And please know that we've heard you, and all of your input will go into informing this as well. And reach out if you've got more ideas later.
And you mentioned a panelist, or was there something we need to mention?
Just thanks to the participants and the sponsors.
Yeah, thanks to everybody.
Thank you, Bailey, for your support.
Thank you, guys.
Thank you, community, for this opportunity.
Yep. Go CHW. See you guys tomorrow.
Woo. Bye, guys.
Bye.
Bye.